Let's talk now to Stanley Perlman, who is a professor of microbiology and immunology at the University of Iowa. Sir, Professor Perlman, it's good to chat with you here on TRT World. So, 5 million cases confirmed, and there have been more than 1,000 deaths from coronavirus daily for the past 5 days, that's according to local media in the U.S. And, of course, according to Johns Hopkins COVID tracker. What are your thoughts on the stage of the pandemic in the U.S. at this particular point in time?
Yes, I think we're at a critical stage because we had hoped that this time that there were going to be decreased number of cases. We were all worried that next month or in October there was going to be a second wave. But instead what we're seeing is no real drop in the first wave. Some places in the U.S. have handled the infection better, so there's a greatly decreased number. But as was noted in the news story, the number of cases in the South and the West is going up. And there's no evidence that we're in a second wave. We're still having a continued first wave that's not getting better.
President Trump says a vaccine could be ready before November 3rd, the election date. But disease expert Dr. Anthony Fauci says it's more likely to happen early next year. What's your estimation on how soon a vaccine could be ready and how efficient it would be?
Yeah, so this is really the key question. We're using a vaccine almost to substitute for the public health measures that we didn't take in time. The vaccine, we don't know which vaccine will work. We're testing several of them. We don't know which one will be best. I agree that we will have many vaccine doses by the end of this year, but also agree that we won't be able to vaccinate large parts of the population till probably early next year. And then we don't know how it's going to work. We don't know how well it'll work. We don't know how long the immunity will last. We are trying to figure out now which populations should get it first, who healthcare providers on the front line we think must need to be protected. So all these things are important. And as Dr. Fauci said, we also have to make sure the mitigation methods that have not been done as regularly and as uniformly across the U.S. as they should be are also instituted. And that's a problem because each state is able to institute its own measures with little guidance from the federal government. So this is a real problem.
Professor Perlman, we've seen images shared online of Miami Beach packed this weekend. Few people wearing masks, and images of a crowded beach in Chicago. Mayor there, Lori Lightfoot, called it reckless behavior. Do young people need to be concerned about the virus? Because, of course, many people still think that the virus would not affect them at all.
Yeah, so this is incorrect for two reasons. First of all, we are seeing young people, particularly those who have other underlying problems like diabetes or obesity, actually being infected by the virus and getting severe disease. The second thing is even if they don't have that, if they get infected, they can then spread the virus to susceptible populations, to their grandparents, to other people who can't handle the virus so well. So the more virus there is in the community, the more likely that people who are really vulnerable are going to get infected by the virus.
All right, Professor Stanley Perlman, we appreciate you speaking with us. Thank you for appearing on the program.